Good evening, everyone. It's nice again to meet you. And I'm Arthur Onyango, and my colleague is.
Jephter too.
Yes, Arthur Onyango and Jephter are just going to tell you why you need to invest in mental health advocacy in Kenya.
Yeah.
So let us just go back to the background of what it looked like and what it looks like. Uh, Mental health world over was viewed from an angle of social stigma, and just it was intertwined into the culture of people because of how it was understood in the past. So a lot of stigmatization was around mental health, and a lot of people were suffering without knowing what to do. But presently, there is a lot of information that people are getting, and there is a lot of change that is happening, and that's what we need to talk about. And maybe Jephta can also just begin by highlighting to us what stigma looked like.
Okay, thank you, Arthur, for the short brief and the introduction is important. Now, stigma in mental health has got to do with people with serious or people with mental health problems are taken to be people low level. They are not comparable to other people. They are seen in a way that they lack some certain maybe basic brain capacity and all that. So they are taken to be in another low. They are taken to be in a lower level than other people. Now, for this case, they are not given equal opportunities to participate in daily activities like going to school, like maybe even in meetings they're not allowed to give kind of their mind. Yeah, and then people with serious mental health problems, like the mentally handicapped, some of them are tied up in rooms. They're not given like opportunities to maybe walk around. They are seen as dangerous people and they can do harmful things to the community. Some are tied into the rooms and not given any space to maybe kind of express themselves or walk around and see beautiful nature. Maybe you can add something if not.
So I also think about the way they are treated, apart from just being tied in the room.
Yeah.
The way they are perceived, they are not seen as equal people, and even sometimes when a matter of on their own health is being spoken about, they are not allowed to
Yeah.
participate. And talking about healthcare for persons with mental health conditions,
Yeah.
access to healthcare in itself was really a challenge, and is still really a challenge, especially for persons with mental health conditions in the villages. Uh, Thinking about it, let's just also reflect on how it is detected. Usually, it is detected late for persons with mental health conditions. This is usually realized probably when the condition is already exaggerated and is already extreme.
Yes.
And
Yes.
you realize that it's already complicated. And what happens immediately when this really is detected? The first point of care that this person will be taken to is probably a place of worship so that they can be treated, or apart from that, they can also be taken to traditional healers who also perpetuate a perspective that is stigmatizing that mental health is from spiritual sphere. You realize that these people perceive mental health to be from magical angle.
Yeah.
Not that people just can develop a condition maybe from their genetical origins. And also you realize that even in the circumstances that they agree that it has genetical connotation,
Yeah.
they also think that probably this is as a result of a ill doing of a person or their ancestors.
Yeah.
So this usually creates a lot of stigma. And when these people also finally access services, usually first of all, we the diagnosis is done using DSM-5. DSM-5 is a binary tool. Either you are mentally ill or you're not mentally ill. So usually it may be hard to detect conditions at very early stages. And also, apart from that, the other alternative tool for diagnosis is ICD-11, International Classification of Disease, the 11th revision. DSM is Diagnostic and Statistical Manual. Yes. 5. So when these tools are used, usually you realize that they're binary. So some conditions may not be detected very early. Yeah. Because there is a threshold that a condition has to be met, has to meet, so for it to be considered a certain condition. So you realize that the spectrum of disease is really an issue. So finally, also talking about access to service, you realize that uh, yes, these people can access service, but usually it's when it is late and when it is often the disease is complicated. So that is the major challenge that we have in Kenya in terms of access to mental health services.
Thank you so much for that. Maybe just to add a little is about the genetical aspect of it. You talked about some people with the mental health, their condition is related back to maybe their forefathers that maybe had the same conditions, kind of. So it is seen that it is passed from their forefathers to maybe their current, which may be true in a way. But then what matters a lot is the treatment measure or the treatment strategy that is given for that. Well, thank you. When we talk about prevention of these mental issues or mental illnesses here, and now it is interesting to note that most of the non-governmental organizations that are mental health related or are health related in Kenya have started putting up some prevention strategies. But it is a bit it's a bit kind of not so much pleasing that the government has not seen an important way of preventing mental health problems. I don't know what you can say about that.
I really think the government has not invested a lot in prevention, but civil society seem to be taking the leading role in this, in my perspective. And I think this is a real challenge because in the end, what really matters is how many people do not become sick. People do not need to become sick. Yes, the government is investing in curative, still not enough, which is, we appreciate the work that they are doing. But we also understand the basic need for primary health care services, just to make sure that people do not get sick. It will also reduce the cost of ensuring that health care is achieved, and also the right to health is attained by everyone. So that is the fear. So probably that is also the future that we are looking at. Yes, Jeff.
Okay. Well, but then maybe before you maybe come to something, maybe a little bit of that. We're talking about mental health sensitization, making people aware of what mental health is. Going to the communities, going to villages, going to families, and that is what most like the non-governmental organizations in Kenya are doing. So they are helping our people to know that what mental health or what mental ill health is. So making them, educating them, organizing seminars, walking to maybe some few health facilities around the villages and telling them more about mental health. What is mental health?
I also believe that is critical because it really reduces stigma.
It reduces stigma. So maybe when you come across a person, you may understand. Maybe if you see a person behaving so funnily, you understand. You say, oh, well, this could be a mental health issue. You don't just judge, abandon, and stigmatize that kind of a person. Thank you. Maybe in something else.
So just talking about sensitization and also reaching out to the community as part of prevention. As part of mental health promotion, we also think about advocacy. Without advocacy and appropriate investment in preventive care, it would not really impact the lives of the people who live in Kenya. But presently, the governments are trying to do something. Just looking at it, Jephter, the government of Kisumu
County.
Kisumu County allocated 1 million for about 1.5 million people. That's about, let's take it in Kenyan shillings, that is about
a coin and a cent.
1 shilling and some couple of, even less than one, it's less than a shilling
for an individual.
I don't know how to put it in dollar per capita for the citizens of Kisumu, so it is very, very little money. But we appreciate the effort that has been put in that direction.
I think it shows some concern about mental health.
It shows that the attention has been given. And also looking at it, so they still need for advocacy at the county level on investment on mental health, because health actually is devolved and the national government is not taking the lead on that. And importantly,
Yeah.
we have also seen that the government has done a lot over the last 10 years, just going ahead to improve the policy infrastructure.
Yeah.
You realize that 2015 the government made the mental health policy, and in 2021 the mental health action plan was put in place, and you realize that also in 2022 the mental health amendment bill was put in place.
Yeah.
So that is of critical importance. But now what is left for us, and that is our call to action, is that investment and time need to be put on advocacy at the county level, so that the government invests, and also the policies that are at national level are made at county level. So we are talking about domestication of policies and domestication of implementation. And me and Jephter, we say thank you.
We say thank you, and we are grateful.
We look forward to another conversation.
But okay, maybe I just wanted maybe to say two things. As we've just notified that mental health is on the rise global. That one globally. That one I think every government should know that. Then we should also take into account that mental health is a basic human right.
Yeah.
So I think that will help. And we are grateful, we're thankful, and we hope this video does great over there.
Thank you.
Thank you. Okay. Yeah.